We all know how important patient safety is. It's like the number one thing, right?
Certainly,
But
equally.
sometimes it feels like we forget about the safety of the people taking care of those patients,
Yeah.
the
And the
nurses.
nurses.
Right.
Today, we're going to do a deep dive into the threats that nurses face every day at work.
It's a big issue.
Uh,
Really, really important. We're not just talking about how happy they are at work, but we're
Yeah.
talking about their well-being,
Yeah. Yeah.
mental, physical, their actual health.
Exactly. And we've got a ton of research and stories from nurses to help us unpack all of this.
Okay.
For example, did you know that almost 1 in 4 nurses will experience physical violence at work?
Wow.
I know.
Scary.
It's a scary thought.
When you think about the places they work, the environment,
Yeah.
it's high stress.
Yeah.
Patients are not
Not the best.
in the best headspace. So I guess it's not that surprising when you think about it that way. Right. So how do we deal with these threats, these outside threats to nurses from patients or their families?
Mhm.
One of the things that I was reading about is this de-escalation training.
Yes.
What do you think about that?
So this is a really good thing. It's not just about like reacting to a crisis when it's happening,
Huh.
but actually about giving the nurses the tools they need to prevent those situations
Right.
from even happening in the first place.
Preventative. I like that.
And the research shows
Yeah.
that hospitals using this training are seeing way fewer violent incidents,
Yeah.
like sometimes 40% less.
That's huge.
It's huge.
Makes you wonder why this isn't
Yeah,
something that every hospital does.
exactly. Why isn't this the standard?
But what about those situations where even with the best training, things still get out of control?
You need a backup,
Right.
right? A safety net.
Yeah.
And that's where these emergency response systems are really important.
Okay.
So think about this. It's more than just your basic panic button. These are systems that use all this cool technology,
Uh-huh.
like wearable alarms, like you can track where they are. And even some of them use voice activation, so that help can get there super fast.
It's like having a bodyguard in your pocket.
Yeah, pretty much.
But how do these systems help with, the emotional trauma that
Yeah.
these nurses face?
That's a good point.
Yeah.
Because, the emotional stuff, the trauma, it's often forgotten about.
Yeah.
But hospitals are starting to realize
Yeah.
that you need to actually have dedicated support, like counseling services,
Hmm.
support groups, so that nurses can,
Yeah.
deal with all that stuff.
Yeah. I
Yeah.
mean, that makes sense because it's not just about keeping them physically safe,
Right.
but also mentally and emotionally safe. But let's talk about the threats that come from
Absolutely, yeah.
inside the hospital, from other people on the care team.
It's a tough topic.
Yeah.
It's a tough topic. But we got to talk about it. We got to talk about
Yeah.
it. Things like, incivility, bullying, even violence
Yeah.
from other nurses.
It's more common than people realize.
way more common.
And some of the research here
Yeah.
uses terms like toxic, like a toxic workplace, which is,
Yeah.
I was reading some of the stories from nurses and it's,
It's sad.
yeah.
It's really sad. And the impact is huge. It can affect, how they feel about their job,
Yeah.
mental health, but even patient safety. Studies show that if the work environment is hostile, more medical errors happen.
Wow. That's scary.
It's scary. It really shows how everything's connected. You can't have one without the other.
So how do we get rid of this toxic culture? How do we make things safer?
One of the things that a lot of people are talking about is these zero tolerance policies.
Okay.
And we're not talking about just putting a poster up on the wall.
Right.
This is about an entire system. Like, we define exactly what is not okay.
Mm-hmm.
We tell you exactly what's going to happen if you do it. And we make sure that anyone can report something without being scared of getting in trouble.
But what about those behaviors that aren't as obvious?
Oh, yeah.
Like, what about those passive-aggressive comments?
Oh, yeah. The subtle stuff.
Yeah. Or being excluded from, important decisions.
Well, that's the thing with these policies, the good ones.
Yeah.
They go beyond just the obvious stuff,
Yeah.
like the physical or verbal abuse.
Right.
They actually try to address those subtle behaviors that can really,
Yeah.
mess things up.
So it sounds like it's about more than just having a rule.
Way more.
It's about changing how we treat each other.
Exactly.
Yeah.
Exactly. We got to talk to each other better,
Yeah.
listen to each other, work together,
Yeah.
and everyone needs to feel
Yeah.
respected.
Yeah.
And that starts at the top.
Leadership.
Leadership, they set the tone. If they're not being respectful,
Yeah.
no one else is going to be.
That's true. It reminds me of something I read about the airline industry.
Mm.
And they've been really successful with their safety reporting system.
Interesting. How?
They've made it so that reporting mistakes or almost accidents is seen as a good thing. Like it helps them learn and get better.
Now, that's the kind of thinking that we need in healthcare.
Yeah.
It shouldn't be about blaming people.
Right.
It's about finding out what went wrong.
Right.
And fixing it before someone gets hurt.
This idea of prevention, it reminded me of this one hospital I was reading about in California.
Oh, yeah.
They actually celebrate the people who report safety concerns.
Well, that's interesting.
Yeah. It's not just like they, say thanks for the report.
Right.
They actually give them rewards.
Wow.
They have this Safety Champion of the Month award, and they get a little bonus, and they announce it at staff meetings.
Nice.
It's so simple,
Yeah.
but it's made a huge difference.
It shows they're taking it seriously.
Yeah, yeah.
And that's the thing about culture. You can't just change it overnight. It's a process. You got to keep working at it,
So it's about more than just rules. It's about making people feel comfortable.
Comfortable and safe.
Speaking up.
Exactly. And that comes down to trust.
Trust.
Yeah. Nurses need to trust that someone's going to listen to them.
Right.
That they're not going to get in trouble for saying something.
Yeah.
And that things are actually going to change.
That makes sense.
Yeah.
But how do you build that trust?
Well, especially if in the past, people have been ignored or punished for speaking up.
Exactly.
Well, leadership is key. Leaders got to step up. And they can't just say the right things. They got to actually do them.
So what does that look like?
Well, it's not enough to just say, my door is always open.
Right.
They need to actively go out and ask nurses for their feedback.
Really?
Yeah. Like hold regular meetings.
Right.
Maybe have a suggestion box where people can stay anonymous or even just walk around and talk to the nurses.
Wow.
Get their perspective.
That's a good idea. All this talk about communication, it's not just good for safety.
Right.
It's good for
everything.
the whole environment.
When people feel respected, they work better together. They're more engaged, and patients get better care.
It's like everything's connected.
Exactly. And that's why nurse safety is so important.
It's not just about the nurses.
Right. It's about the whole system.
Which makes me wonder, what about the people who aren't in healthcare? What can we do to support nurses?
That's a good question. It can feel like a really big problem.
Yeah.
But there are things we can all do.
Like what?
Well, first, we got to change how we think about nurses. We can't just see them as these, selfless caregivers who never complain.
Right.
They're professionals. They deserve respect.
Just like anyone else.
Exactly. So be kind. Be understanding. And even small things.
Yeah.
Like thanking a nurse for their work.
Right.
It could really make a difference.
And we can also support those bigger changes.
Yeah.
Like policy changes.
Absolutely. Things like making sure there are enough nurses so they're not overworked, or stricter laws against people who attack healthcare workers.
So there's a lot that needs to be done.
There is. But we can all play a part. Talk to your friends and family.
Yeah.
Write to your elected officials.
Right.
Even just sharing an article on social media. It all adds up. We got to support our nurses. They're the backbone of healthcare.
It's really encouraging to hear about all the work being done to make things safer for nurses.
Yeah.
But I keep thinking back to something you said earlier about how, nurse safety is kind of crucial.
It is.
For the whole healthcare system.
Oh, absolutely. If nurses are safe and feel supported, they're going to be able to take better care of their patients.
It's like everything's connected. Safer nurses, better care.
Right.
A stronger healthcare system.
And a healthier community.
Exactly. And it's not just the physical safety.
Yeah, no. You got to think about the whole picture.
When nurses feel respected at work, they're less likely to get burned out and more likely to stay in their jobs.
Which is huge.
Yeah.
Huge,
yeah.
Especially now with the staffing shortages.
Yeah, that's a big problem.
So, yeah, nurse safety, it's not just about protecting individuals.
Right.
It's about the whole system.
We've been talking a lot about prevention.
Yeah.
What are some of the, most interesting things you've seen hospitals doing to, really get ahead of these safety issues?
Well, one thing that's really cool is simulation training.
Simulation, like
it's like a dress rehearsal. They create these really realistic scenarios. And the nurses get to practice things like de-escalation techniques.
Oh, wow.
Or what to do in an emergency. Even how to handle, difficult coworkers.
So it's a safe space to make mistakes.
Exactly, and build that confidence.
Yeah.
And some places are even using virtual reality.
Really?
Which is
that's so
next
real.
level. It feels so real.
It seems like hospitals are really getting creative
They are.
with how they're approaching this.
And technology is great.
Mhm.
But you also got to think about the root causes of the
Right.
problem.
Like what?
Well, sometimes it's just that patients and families don't understand what's going on.
Hmm.
So some hospitals are doing a better job of explaining things,
Okay.
managing expectations. Others are focusing on communication, making sure
Yeah.
everyone's on the same page.
So it's about reducing that tension that
Exactly.
can lead to those bad
Now,
situations.
remember, nurses are a big part of this.
Yeah.
They need to feel empowered to speak up.
Which brings me back to what we were talking about before, about how all of us,
Yeah,
even if we don't work in a hospital,
right.
can do something.
Absolutely. Start by just acknowledging how tough their jobs are.
Yeah.
Thank them. Learn about the issues. Talk to people.
And support those policy changes.
Exactly. Every voice makes a difference. Write to your representatives.
Yeah.
Talk to your friends. Share an article online. It all helps.
Well, this has been a really eye-opening deep dive. I've learned a lot
Me too.
about just how complicated this issue is
It is.
and all the great things that people are doing to address it.
It's really inspiring.
So, to our listeners, we hope this deep dive has made you think about
Yeah,
the safety and well-being of nurses and how important they are.
so important.
Their safety is our safety, and we can all do our part to make things better.
Thanks for listening.